Okay, with this we are coming to the last session of the day, which is the Canadian Research Update and Spinal CSF Leak Initiatives. If we can have the next slides, please. We are going to present a couple of projects that we're trying to do to really improve the research about SIH here in Canada as well. And our first project, I'm proud to present our results of the survey on Canadian patients' experience of diagnosis and treatments of CSF leaks. That was published in last November 2024. The reason why we thought of doing this paper is, as we have noticed during this day, that there's definitely a lot of challenges still here in Canada, and patients are waiting, have difficulties in finding the right diagnosis and treatment, and are suffering while they're waiting for treatment and diagnosis. And to be honest, this is a bit of a global experience. We've seen, like in literature, from a survey from the UK, for example, that data presents itself similarly. But interestingly, there was an experience or an observation that we have, but we didn't really have clear data to prove that Canada also had a problem, only anecdotal evidence. So we put our heads together and we came up with a plan for a Canadian survey, primarily trying to identify barriers and challenges to accessing care and to diagnosis and treatment of patients with CSF leaks in Canada. And at the same time, we also wanted to identify demographics, wait times for diagnosis and treatment, impact in quality of life and financial health, and the need to seek care abroad. So we designed a survey, which we made in RedCap, that included 80 questions that we advertised virtually through our social media and on the Spinal CSF Leak Canada website. And it was in collaboration with Spinal CSF Leak Canada and approved by University Health Network. In terms of study population, we merely were focusing on adults of 18 years of age that were Canadian citizens or permanent residents at the time that they were suffering from their positional-related headaches. And we, of course, excluded patients that didn't want to participate and that were not living in Canada at the time of their illness, because we really wanted to focus on Canadian experience. We aimed to collect data on 90 patients. So the results are as follows. So over the course of the 6 months, we had 231 patients responding to our survey. And of those 231, there were 103 patients that were confirmed CSF leak patients. And we collected data by asking questions about their demographics, their diagnosis, treatment and follow-up, relapse, rebound intracranial hypertension, aftercare, and their financial health. From the results, we basically learned 5 important lessons. And the first lesson is the affected population. So the average age of our survey participants was, the median age was 40 to 49 years old, and 83 of the participants were female, and that basically correlates with the literature there that CSF leaks happen more in females. As a consequence, because the population is quite young, there's a serious impact on employment and financial health. 12% of the population was not employed at the time of the survey, and 42% of the patients were on disability leave. Of the 46% of patients that were working, almost 90% needed modified work duties to be able to work their or perform their duties. 38% indicated that they had lost their job due to this disease, and a staggering 82% admitted to have been financially affected by this disease. A second lesson that we learned was about the lack of access. So almost 80% of patients indicated that it took at least 4 healthcare providers to see before they got like their diagnosis. And more than 42% of patients said it took them more than 4 times, up to 10 times of emergency department visits because they were just desperate to get the care that they needed. The average time to diagnose was 6 to 12 months. However, if you count the numbers, almost 35% had been waiting 2 years and more to get a diagnosis. And once they were diagnosed, like 40% still had to wait up to 3 months before they get their first treatment. The third lesson was out-of-country care. So a lot of patients, because of desperation of the impact on their health and lack of clear referral patterns, went to seek help abroad. And these are the centers that they visited to get a diagnosis and treatment. So some of them are in Canada, but there's a lot of centers, as you can see here, that are from across the border. Maybe apologize for the numbers, it's not very well noticeable here. 80% of the participants were investigated in Canada. 16% actually went to the States for investigation. 54% said that they had received treatment in Canada, and up to 26% of the participants had received treatment in the US. So obviously, because of, interestingly, 61% of our participants indicated that they had self-funded their trips and their treatments out of country, probably because they were or not aware of the like OHIP support programs that are available, or did not want to wait to get the approval, which can sometimes take a couple of months. So that was a staggering number, 61%, and the mean approximate cost of this investigations or treatment that they had received was about $66,000. Once they had received the care or the investigations or the care that they needed, they indicated that there was a clear lack of follow-up. Almost 53% of patients indicated that they had experienced some degree of rebound intracranial hypertension in the weeks to follow their treatment. However, 77% of the participants indicated that they had difficulties trying to find the care that they needed or to talk to somebody how to handle with this RIH. 44% of patients relapsed after their initial successful treatment and indicated that they had difficulties trying to come up with a plan after this first failure of a treatment. Interestingly, a lot of patients also indicated that they did feel a need for physiotherapy or mental health service because of the impact, of course, of this disease on their overall life. However, a very low number only had received physiotherapy or mental health service. So these are, of course, not the best numbers, and it is always interesting to then look like internationally if these data is somewhat different. And if we compare this to the numbers we see from the UK and other places around the world, the data is very similar. So this study, although it was a survey study, learned us that there's definitely work to do. The downside of this is of course a survey, so we have to take care when we look at the data. The data is a bit prone to some biases. However, we think there's definitely some lessons to learn and how to improve Canadian care. So there's a couple of things we are doing and that we will keep on doing. We try to increase the awareness, and I think with the Spinal CSE Fleet Canada is an excellent organization to indicate and to raise awareness with these conferences. At the same time, they organize a lot of workshops and virtual programs to really reach out to physicians, healthcare providers, patients, so that they feel supported and get more education as well. And there's, of course, a need for more multidisciplinary SIH centers across Canada with clear referral pathways, clear pathways of treatment where patients can find their care no matter how complicated it is. We try to be there for you. At the same time, there's of course a need for more research. I actually pulled some data this week on the numbers of papers that are coming out. If you look at the data before 2000 and the last like 20, 15 years, of course there's an increasing trend we were very happy to see, especially in the last 10 years, 5 to 10 years or so, there's more and more high quality publications that's coming out. But of course we need to do more and we need to do better, and we are all committed to do so. So as a conclusion of this first national survey in Canada, we have seen that the affected population are, in our survey at least, predominantly active, highly educated females. SIH has a highly disabling and significant impact on patients and impact on financial health. It was clear that our Canadian patients have a lack of access to care due to awareness and due to delay in care as well. And therefore, more often than not, tend to go to out of country, which is common and unfortunately also expensive. And we're trying to change that by creating these multidisciplinary specialty centers across Canada. Importance, of course, is also the lack of aftercare, as some of my colleagues have indicated as well. Unfortunately, SIH is a disease that comes and goes, and patients do relapse. So we need to follow up on them better, longitudinally, so that patients feel supported along the way. Overall solutions are more awareness, a better organization of the care pathways, referral pathways, and high quality research. Thank you.